Hey guys, welcome back. Today we are listening to Dr. G, Medical Examiner.
Color, it's
Volvulus?
necrotic. And when I mean necrotic, I mean dead. You can't survive this. It's dead. It's gross. It's gone. It's necrotic.
From Crohn's
That
disease?
bowel has twisted on itself. It has strangled itself. What we call a volvulus. It's like you're twisting a hose, and the blood supply then gets kinked, and that's not going then to supply blood and oxygen and nutrients to that bowel, and it starts to die. And then bowel contents even start to leak out. For people with Crohn's, that's a very unusual finding. We just now have to figure out what's causing
it was so mild it caused the volvulus.
Dr. G is now on a mission to discover how this could possibly happen. Finally, in the abdominal cavity, she makes a discovery that helps her make sense of it all.
Oh, here it is. It's right in there. I clearly know why she died, and the reason it occurred is quite abnormal.
Not to scare you guys, but occasionally I will have
28-year-old Rebecca Davis has been living with Crohn's disease for the past 8 years.
She got diagnosed with Crohn's at the tender age of 20. Hers comes and goes. She has the bouts where she's having terrible abdominal pain, cramping abdominal pain, fever, bloody diarrhea. She's getting used to that. She was living pretty well with it.
But over the years, Crohn's has damaged her bowels, causing minor scar tissue to form. And unfortunately for Rebecca, this scar tissue develops in the worst possible area, acting as a pivotal point on which the rest of the bowel rotates and twists on itself.
What she had was scar tissue in the belly, causing it to twist, and it just turned on itself and strangled its blood supply to that portion of the bowel. This bowel probably was cutting off its blood supply over a period of time. It probably didn't happen all at once. This strangulation of the bowel is unusual because usually people with Crohn's have so much scar tissue, it doesn't even have that mobility usually. So it can twist. That's more frozen in place.
Ironically, the fact that Rebecca had only minor scar tissue, but not the typical severe case, is what seals her fate.
Her Crohn's probably wasn't all that bad, just bad enough to let it rotate and strangle her bowel. She didn't know that that night the bowel's totally cut off the blood supply and starts to die. So she's having a lot of abdominal pain.
Tragically, Rebecca only thinks she's coming down with the flu, or at the very least, another flare-up of her Crohn's. And she cancels dinner with her parents.
This is a true surgical emergency, but she didn't really know what was going on. Surgical emergency, but she didn't really know what was going on.
And despite the pain, she doesn't seek medical attention.
Usually people with chronic pain and a chronic condition, they get very familiar with that condition. I think she didn't recognize that this was a much worse problem going on.
I just get irritable.
As she tries to fall asleep, the dying bowel causes waste and bacteria to leak from the intestines, which in turn triggers a massive infection called peritonitis in her abdominal cavity.
The bacteria got out of the bowel and got into her abdominal cavity, which is not where they should be. And then the bacteria start decomposing your tissues. That's why she was looking a little more decomposed than I would have expected, because the bacteria had already gotten the upper hand on her with that terrible infection going into her belly.
The infection soon enters her bloodstream and rapidly spreads throughout her body.
Her lungs and heart.
It's too late.
The body's trying to fight that off, and that infection just overwhelmed her.
And she didn't fight out at all.
She eventually loses her blood pressure and dies. This is a rare complication of Crohn's. Most people don't have this complication, but unfortunately it was the perfect storm. If you go to the hospital, with the severe pain and they take you to surgery to remove that bowel, well, you have a good chance of surviving it.
Right.
But without any surgery, it's 100% mortality. Unfortunately, she didn't seek help because she thought she was just having another one of her episodes.
A few weeks later, Rebecca's toxicology results finally arrive.
I'll
And they're
leave
perfectly clean.
the